But I think that the contrast there give us a great deal of insight. And much as we're watching in the moment, the decision to go back, to work and so forth and so on is causing a great deal of discourse, and rightfully so. And yet we're still not addressing it either from the federal level, and in some cases we're attempting to address it from the state level. But really most of that resides in the communities. And there's the thought that the mayors are going to be instructed by the governor. And I'm not sure that's true. If we look at the situation that Pontiac represents with its relationship in Detroit, Flint, and so forth and so on, all of those are different, similar, but different. And in that, we have a lot to arbitrate in terms of what is local, what is working locally, what isn't working locally. And that can be as different from 5 miles or 50 miles. And in some cases, they can be similar. And Katha, what's your thoughts along those lines in terms of the similar propositions that might be faced by a number of different communities?
Yeah, I think what we have seen with the COVID-19 and the universal pandemic, we've seen some major shifts, and I think some of them are going to be permanent. But one thing is for sure that supports what we're trying, the work that that we're trying to do, is that when we come out of isolation, whether it's sooner or later, the whole idea of social interaction is going to be different. And I think we have to recognize that this whole idea of being able to interact with people has been taken to a new level. People recognize the importance of social gathering and social interaction. College students are saying, hey, I'm not going to pay $50,000 to take online courses because I am missing out on something, not being on campus and being able to interact. Parents are finding that schools were important for a lot of reasons that they hadn't really thought about. Their kids are missing their friends, and it's causing a tremendous amount of trauma with children that they don't, my daughter, when I tell her, well, I tried to call you, and she says, well, Blake had the phone because I'm constantly having to give them my phone because they want to call their friends. So social interaction is going to take on a new significance. Now, how we deal with that, I think, is going to take place on a local level. I think, in a way, we always seem to look for national direction and some kind of a national program or plan. But I think going forward, I really think the new normal is going to be, the hot spots are going to be the local spots that we're able to bring all four of those things that Scott talked about together. And those communities that are able to bring those four aspects together, to get the governance in line, to get the sustainability right, to get the equity right, to get all those things right, those communities are going to take off. And it's going to be pretty much independent of larger entities like state government or federal government. So I think there's a lot that's happening that's going to be positive, that's going to work out positive. The fact that it's going to be more local, to me, means that we will have more control. We will really have a real shot here at making some things happen for our community. I think people are more in tune now with local government. They are not so much looking out at the big picture, but most people now, I notice even all across the country, are much more in tune with what's going on in their local government and in their own community than they are with what's really taking place in Washington. So I know it's that way for me. So I think there's some positive things, but definitely I see game changers here, that I see new normals, and I see things that we are just simply not going to go back to the old way.
That's
So,
Awesome.
in that it reflects the exact opposite of what the federal government is attempting to pull off, which is a healthy outlook, I think, from the standpoint of hyperlocal. Hyperlocal has been held hostage, but we have technology now that unleashes hyperlocal.
yeah. Well, now that's my opinion. If anyone else thinks differently or thinks that has a different perspective on it, but I definitely see the local entity is being a lot stronger after COVID-19.
I just want to bring up a thing, though, that everybody on the local level should have a red flag about. I was listening on NPR today, and something came up that really worried me. And it was this mention of this sort of segregating of space, like having flights where like people who are more high risk are going to have separate spaces than folks who are considered less likely to get COVID. And that just this idea of this sort of segregating, we're talking about different flights, and I'm thinking, oh my gosh, public spaces are different.
Wow.
Yeah. So because I heard that, and they were saying because COVID could be lasting for quite some time, this idea of segregating spaces, I just said, oh my gosh. And you think of people of color considered more high risk. Could we have like new forms of basically racial segregation, but under the justification of health risk? So I think that even if things are done at grassroots local level, that all people working at the local levels need to have be very, very alert to this kind of language or this kind of thinking about the segregating of space. Because to me, that's a very big red flag right there. If I'm already hearing stuff like that on the radio now, we need to be on the.
Yeah. Wow.
Can I speak on the topic?
So
go ahead. Brie was going to say something, I think. Brie?
Yep.
Yeah, so I just wanted to speak on this topic because I've also heard the rumor of, when we talk about like COVID and how we address COVID, and then what that affects, just the same thing as we literally was pointing out, how that affects our public spaces. The media is going to also sell us a portion of that story. And so watching the media, make and twist things, I do believe that it is a myth that people of color are at a higher risk to get COVID. When we talk about, already having pre-existing conditions, we just know that that's based on health and overall general health, and race has been removed from that conversation when you start to talk about people in the South's health versus people in the North or out West, in places where you can get better sourced food. So just the general conversation around the entire United States, and then the media, that conversation is also another point that I wanted to put in. So it's worried me a little bit that that's been a part of the conversation here recently, about race and how susceptible you are to COVID due to race. So what does that mean for our children who go to inner city schools after this is over? What does that mean for, people who are in public spaces that are government affiliated, like project homes, like that still exist, that we know still exist. So that has to do with, parks, our children having parks now, them trying to remove parks because we know that touching physical items in a park spreads COVID. You know, so giving an excuse to go in and remove already needed amenities is what I see being a problem across the United States, but specifically for me in the South, where a lot of brown and Black people still do live inside of project homes and community spaces that have to be shared by more than 50 people at a time. So I don't know if that's too deep or too much to say, but that's my reality here in the state of Tennessee. And it's been my reality growing up. So I've watched people, you know, use that as an excuse to strip away public spaces.
Yeah.
Well, that's certainly a conversation that's going on with our brothers in Detroit and so forth and so on. And I'm sure we have that as well in other spots that are hotspots in other states and so forth and so on. But I don't see it breaking, and it's good to hear that someone picked up on that. And Corinna, that was that